into play there, and that again will play out as we talk about reopening and kind of recovering from this crisis in an equitable way. So we'll talk about some considerations for that. For mental health, we know that property folks have been incredible in their creativity and their persistence in helping their residents manage this, and not just in a physical health way, like maybe you do have some positive cases at your communities that you've become aware of. Maybe it's other physical health concerns that that have been harder to manage for residents because they're leaving their units less, and they don't maybe have the electronic literacy to utilize telehealth options. And then the mental health aspect, where there's been fewer eyes on, less service delivery, a lot of isolation happening, and the health impacts of that. For resident supports, as well as responsibilities, HUD has provided some resources. We have pressed them harder on this because it's the reason we're all here, right, is to serve our older adults and keep everybody as healthy and safe as possible. And so HUD has provided some information. That first link on the slide is all about food resources. And that's a PDF that could be distributed at properties with, food bank information by zip code and food stamp or SNAP benefit information and other types of resources, maybe with the local agency on aging, et cetera, different ways to access that. But that is just an example of the kinds of things you all are doing to keep residents supported throughout this. HUD also provided a brochure on tenant rent rights and responsibilities during this time. And we felt that was really important because it goes over a couple of things that a lot of folks got questions about. So we are still under 120-day evictions moratorium. And of course, there was some confusion about that, both on our end, on providers' end, on resident end. I think the most common question we got is, well, do I still have to pay my rent? And, we spoke with HUD many times about this and said, you have to put out some really clear things, some clear information for residents, for providers, so that we don't get into a kind of a financial bubble situation later where folks think that they don't have to pay right now, or, maybe they're not able to pay, but they don't make use of the options that are available for that, like interim income recertifications. And then later, when the evictions moratorium is lifted, suddenly they're in a lot of financial instability and stress. And similarly with the provider having a lot of financial revenue loss there. And so HUD did provide this brochure. It goes over options that residents have, rights that they have, and also makes very clear that rent is still due right now. On that note, HUD does have some information in their FAQs about the considerations that a provider might have around assessing late fees. For example, if you had a situation where you had late fees prior to the evictions moratorium, you're not allowed to assess late fees during. What happens with those that were assessed before this moratorium, how that comes into play after. So if you have questions about that, they have provided some good detail there. And I've heard from communities where they've distributed this brochure. It's available in many languages. Thanks to Linda for doing some extra effort to get that in lots of languages there. And they've distributed this to folks, and suddenly folks were like, oh my gosh, I did lose income. I do need to do an interim recert, and so that the brochure has been helpful. It is not the resident rights and responsibilities brochure overall that's required to be distributed annually and checked on MORs. This is just an informational brochure. Lastly, on this resident support side, I wanted to mention, one of the other main questions we've gotten on the resident side is about those stimulus checks that were provided, that were approved by Congress at the end of March. And these were $1,200 roughly for individuals, and based on income. And we got a lot of questions about how that would interact with eligibility and income, rent determinations. We also got questions from folks who said half of my residents haven't gotten these checks. And so we've done a lot of looking into these checks. HUD did put out information about how to handle these, and these do not impact rent determinations or eligibility. So these are disregarded as income. This is sporadic, so not to be counted. In terms of getting the checks, we have a link there with some more information, especially for SSI, Social Security recipients, Veterans Affairs, Railroad pension beneficiaries. So there have been some delays, and there's some information there in that link. Let's see. Okay, jumping into some of the more detailed parts, and this is where some of you might want to go take a nap. But I wanted to say that HUD's main approach throughout this crisis for getting information to providers has been through this FAQ process. And so the link is there. It's on their multifamily housing website. And in the beginning, my goodness, they were updating it sometimes twice a week. And this was direct responses to questions that you all sent us. Things like, what do I do if there's an outbreak? How do I clean? How do I do an interim recert right now? Those kinds of questions. And now they've slowed down a bit. They have updated it twice in May. We're expecting it again. So HUD is absolutely on it. They have been working very hard, just like we all have. But of course, we need to see a lot more from them, and we continue to send them lots of questions. They're so tired of hearing from us. So I wanted to go over the main things. The current document is many pages long, but I won't, don't worry. I'll just go over the main pieces. Messaging to residents. So this has a lot to do with, what to do if there is a positive case on site that you're aware of. This also has to do with if you don't have a case or aren't aware of it, but you're communicating to residents. The gist here and the kind of zoomed out version of this is that HUD, as you know, is very particular about staying in the housing space. So they do not have not, and we don't see them shifting more into the health lane in terms of providing more guidance. So what that means is that in these FAQs, you'll see a lot of referrals to CDC guidance, deferring to local health departments, state health departments, etc. But what they're saying about messaging to residents, the most important thing I want you to take away from this is that as you're communicating to your residents, you have to maintain privacy and HIPAA requirements. So that means if you do have a case on site, and if you do, you know this already, that if you're, you can and you should talk to the other folks at the community about that risk, but you can't do it in a way that reveals any sensitive information. So personally identifiable stuff like unit numbers, last names, etc., not to be used in your communications. However, you can, put up signs at entryways in common areas to individual units about a risk or about policies that you have put in place or that you're continuing. And I know that you all are doing a great job communicating with your residents about what's needed right now to keep this a safe as possible scenario for everyone. I'd also would really like to see folks exercising compassion right now. We know that this is a tough situation on everyone, and that change is hard, and it can sometimes be particularly hard for older adults. And so, there can be a tension between what you're asking them to do, of course, and what they're doing. And HUD is really folks to steer away from uses of lease violations and whatnot, and leaning more toward transparency, communication, emphasizing that we're in this together. But of course, that is more difficult in practice than it is on HUD paperwork. So, and just a last piece there is that HUD is very aware of fair housing and kind of discrimination and stigma around messaging, and so they're asking folks to be mindful of that in your messaging. Some of the biggest news early on in the crisis was the suspension of inspections. Thank goodness that happened so early. That was our main ask in those early days. And so HUD had very early suspended REAC, physical property inspections, and then also MORs, file reviews. And as we kind of move as a country at different paces toward adapting to this new reality and possibly reopening or loosening restrictions, we know that it's on HUD's radar how they will move forward with this, with those inspections. So stay tuned. We're of course asking them to give some leeway, to give some more time, and in particular on the MOR, so the file reviews, we've seen them give a little bit, and they're moving toward more virtual aspects of the file reviews. But more on that later. Income recertifications, this was something that HUD gave some great flexibility around, and was, another one of our key asks of HUD, and that was to support you all in making those happen, both interim and annual, in a way that prioritizes the health of residents and staff. So that means giving some time leeway, so allowing annuals to be a little bit later, providing some codes for tracks if you do have an extenuating or a medical circumstance, like somebody's quarantining and you can't complete it, and so what you can input into the system. Having some flexibility around uses of electronic documents and signatures, and then on their end, prioritizing the interims so that that rent can get lowered, so that the financial strain becomes less of a tension. On unit turnovers, this is after the research was the biggest issue, and I know it still is, and that is both move-ins and move-outs. On the move-ins, you saw we had a polling question about that, and that's been really thorny. So HUD's stance on that was that they really asked folks to continue those as much as they could, and to find ways to do that safely. They provided some flexibility with that. So the same kinds of electronic flexibility is available for certifications, was available also for new applicant processing. But we did feel that it wasn't totally realistic in some areas to be able to do that 100% safely, especially interviews and whatnot. And so they did say that they would view those on a case-by-case basis if, for example, you had an extended vacancy as a result of delayed move-ins, and that they have been good in accommodating those special claims. And so if anybody has had an experience with that, especially if it hasn't worked, please let us know so we can take that to HUD. On the move-outs, the main issue was the 14-day after the death of a sole resident, and that has been a sticking point. We know that that's just not enough time for family to get in there during normal times, but also during a period of time where they might have to quarantine, and so we're continuing to ask for some flexibility and subsidy extension there. Residual receipts, this is something that, we're very concerned about the financial impacts of the crisis, and I'll talk a little bit more about that later. But what I want to say about that is that HUD did allow some flexibility in terms of keeping some of those funds in your operating accounts for the time being, and that's good news. That is a good trend that we'd like to see HUD go more into the direction of, in particular with surplus cash later on. But for now, they're allowing a delay on that remittance, and so there's more info in that link there at the top. Big one, and this is basically breaking news. You guys are on the front lines. This is electronic signature guidance. My goodness, we've been waiting for this for a long time, and if not 20 years ago, I guess the best time is yesterday, right? So, or last week. So this allows, but does not require you all to adopt policies for electronic signatures, documents, files. This is great, and the feedback I've heard is basically it's so good that people haven't wrapped their minds around it yet. They're like, wait, it's so flexible. Are you sure? So essentially anywhere that existing HUD guidance references a paper document or a original signature, you can interpret that and implement that as through electronic means. There's some, limitations, of course. There are a few exceptions, as there always are, and there are some needs that need to be met as well, like around state requirements. So a state might require that your lease be in paper form with an original signature, and so this isn't going to change that. Also with the ADA, you have to continue making reasonable accommodations for folks if they can't use electronic means, etc. But those, I think, are really straightforward. The gist of this guidance is that it's very flexible. So this is for sending stuff to HUD, sending stuff to residents, storing files, completing your documents. It doesn't change the type of document you need to complete. It just changes the method for it. And that's fantastic. So if you're using paper files, you can choose to convert those. You can choose to have a combination of paper and electronic means, and then you just maintain the kinds of equivalent criteria for security, for privacy, just like you do now. And the standards for that are all listed in the notice. So that's things like a PIN or a digitized signature if you're implementing that. Of course, there are some considerations around that, like what kinds of software you might need, and right now during COVID times, how to like if you decide to use iPads to have folks DocuSign something, disinfecting in between uses, that kind of thing. So there are always considerations, and very, very curious to hear from you if you have thoughts or needs around the implementation of this. I will say that during COVID times, this is not COVID-19 guidance, but this is particularly useful right now. This extends some of those electronic flexibilities that have been put in place by HUD for the income certifications, for example. So that will extend those, so that will help if you're able to implement that. It also allows reviews to be done easily or more easily in a virtual way. So HUD's MORs can be, per this notice, completed virtually if those files are available in that format. So that's good news as well. Okay, jumping into some financial issues, and this is really where we've seen a lot of burden, and that's both, of course, on residents and on providers. We know that HUD and Congress and folks, and Linda will talk a little bit about this later, but that they've been very focused on this idea of if a individual loses income and how to kind of make up that subsidy. But we know that that's only one piece of this pie, that there is, in fact, a huge area where you're not just losing revenue, but that your costs have gone up incredibly in some cases. And that's for things like supplies for cleaning, masks, for overtime for staff, and whatnot. And so that is really been a struggle, and that a lot of providers have gone above and beyond to try to keep residents healthy and safe by trying to coordinate laundry services and deliveries and whatnot. And so we're really pushing HUD on this. And some of the areas that they have provided some flexibility is around reserve releases. So we know that they're allowing non-traditional off-cycle releases, and that has happened successfully for many providers, so let us know. There's also forbearance options, and then those residual receipt offsets that we talked about. The surplus cash is something we're pushing them to be able to keep as much in the operating accounts as possible, and to have that be as flexible as possible. So things we know you can spend money on are those supplies, like I mentioned. You can also use your funds for masks, both for residents and for staff. So those are some good flexibilities. We'd like to see that become even more flexible. And I know Linda's going to talk about this more later, but HUD does have money available for both project-based Section 8 and Section 202 and service coordinators, and HUD has been a little slower than we'd like in getting those funds out, and so we're pushing them on that. They did get some dollars out for project-based rental assistance through Section 8. Nothing yet, though, extra for Section 202. Linda, were you going to talk more about that, or should I talk more about that now?
I was going to mention that they put out the money, but only to make up for the lost tenant income. So if you want to talk about the use for the vacancy, that'd be good.
Yeah, yeah. So as Linda said, and again, this is that kind of push pull between the, your revenue loss versus your expenses, and these dollars that HUD put out. And so if you have Section 8 as your operating subsidy, you could benefit from this, but it's not COVID-19. It's not money to plus up your accounts for all of your extra staff time. It's money that will only go toward the subsidy on your HAP for if a tenant has lost income. And then the other thing, and this is a good direction, is that HUD has said that they will also use those funds to accommodate for extended vacancy claims. And so we're very happy to see that in there. We know that they reserved some of these funds set aside, and we hope that they'll be putting that out more for COVID, unexpected COVID expenses. Okay, so we're going into the exciting topic of the, oh my goodness, this has been the main topic, I think, in the news and for everybody. And Scott, was it June 12th, I believe, for Georgia for reopening?
Yes, that is, shelter in place order is June 12th, but then the public health emergency goes through until July, I think mid-July, I believe it is.
Okay. Yep, and that gives as you guys know very well, that gives some insight into this idea of reopening, and that even that word being a little limited. So what does that mean for housing providers? We've worked on this a lot across various settings. So let me try to share a different screen. Let me see here if this will work. Can you guys see this? Okay, great.
Yes.
And I know it's not in landscape format, so I apologize. It's not the best format for sharing, but this is on our website and the link is in that slide. What this is a 4-page kind of like a toolkit, but what it is considerations that that affordable housing providers might have, not just for a one piece of a reopening, but this longer idea of recovery. So we've talked about it in different ways. We've talked about it. Some people, have used the dimmer switch analogy, where this is not, a light switch. This isn't something we can just flip back on and we're back to normal. This is something where this is a gradual recovery, and we might see some progress and then some setback. And this is just like after any disaster, a longer kind of phased recovery.
Juliana, can you scroll that up just a little bit? It doesn't fit in the full screen. That way people can kind of see the whole, there you go.
There you go, yeah.
Diagram there.
Yep. And actually, let me scroll through all of it just real quick. So you'll see there's way too much text. Don't worry. I'm not expecting you to know it all. So that was those are the 4 pages. So let me start up here at the top. So this is essentially a matrix for the kinds of decisions you might have to make. And you'll see in the center in that yellow piece, and I do apologize for folks on the phone who can't see this, but again, that's available online, is this idea of responsible recovery, right? It's the reason we're all here, is to get through this as best we can, and then to learn from it and hopefully do better. And you'll see the different considerations that we have, and that includes federal requirements. So that's things like what HUD is saying, what the CDC is saying, what the White House is saying. I'll go into that in a little bit. It's things like what your state is saying, what your local area is saying. So that, for Georgia, like we heard, that's, a stay-at-home order might be lifted, public health emergency. So those are really important to keep in mind as they interplay with the federal requirements. You also have the health and housing needs of your residents and of your staff. And then this idea of workflow limits and opportunities. So this is something where, for example, if you have adapted your some of your policies, like for example, maybe your service coordinators have switched to doing a remote weekly wellness check instead of doing that in person, you might take a look at that and say, wow, that really worked. I was able to really connect with them. They responded well to that. I'll keep that in place. But maybe you have, so that would be a workflow opportunity that came out of this kind of crisis, and that you can incorporate into your reopening. But maybe there's a limit to this as well. Like maybe if you want to open up a common area outdoors, but you don't have the capacity to monitor that and the way folks are using it, then that might tell you that you would keep that closed a little longer, for example. And then with equitable recovery, this gets back to what we were talking about with the way this affects the crisis. The virus has affected different communities differently. And this is race, this is ethnicity, this is age. This is all different kinds of things that we need to keep in mind as we're moving forward in a way that elevates everybody's health. And so, for example, if you are considering switching your wellness checks or your resident interactions that you're having or your programming, if you're thinking of switching that back to the way it was, but some people maybe aren't comfortable coming down to the management office yet because they do have underlying health conditions, then that means that would be an inequitable way forward at your community. And so, for example, instead, an option would be to maintain some electronic or some virtual options and incorporate in-person options so that everybody feels comfortable and can move forward in a healthy way. So that's just one example of the way that impacts your reopening considerations. Okay, I can't believe the designers let me keep this much text on this page, but I'll just go over it real quick. It's an example of the operational issues, federal guidance on it, and then the kinds of questions you might be asking yourself as you reopen. So you'll see the first one is that unit turnover and that idea of move-ins and move-outs. The HUD stance on it, that they're saying that they do want folks to continue moving people in. We get it. There is an affordable housing shortage. It's important to stably and safely house folks, but that also includes your current staff and residents. And so then the logistics of that you would keep in mind as you build that into your reopening plans. Same with visitor restrictions, same with your workforce. So with your teams, if they've been off-site, what HUD has said about that. So HUD has said management office hours, that's at your discretion. You can curb those, whatever you need to do to make that happen safely. If you have service coordinators though, those are for a certain number of hours or a percentage, they need to continue fulfilling those hours, whether that's on site or virtually or remotely. And then the kinds of challenges and opportunities that you might have with working off-site or transitioning on-site. So we know some folks have moved to on-site, they're maybe keeping the door closed, the management door closed, maybe they're wearing a mask. Maybe service coordinators are going in to the office sometimes because they have some HIPAA constraints around taking files home, for example. So this gets all into those thorny details of how you reopen responsibly and effectively. This is a little bit of a roadmap for helping your teams achieve that. So you have a 4-step process here. You're identifying your lessons, you're assessing what your capacity is, you're prioritizing what needs to happen, and then you're adjusting your systems. And this can be done with the use of some tools that HUD has encouraged folks to use. These are tools from HHS. So this is things like a template to talk with your teams about what they learned, or a survey of your employees. I think I'm probably going a little over on time, so I'll just make this a little short. This is the kind of the longer view picture of how to position ourselves better for the next time. So taking a look at your operations, your communities, your residents, and figuring out what would help them become more resilient to future disasters. So this is things like flexible scheduling for your staff, or having contingency plans for your suppliers, and helping your residents have stronger support networks. So this is the idea of resiliency. Okay, let me just go back over to, let's see, here we go. And don't worry, I'll switch it over to Linda very soon. Let's see. Yep. Okay, this is the last you'll hear from me. All right. So the preparing for hurricane season. This is such a big topic, I know, for many areas and for you all in particular. And definitely see this as the start of a conversation with you all. Please let us know what you might need. The picture right now is that the CDC, this is very much on their radar, that this hurricane season is very different from previous ones, and possibly harder if if possible. It's become even harder. And so what the CDC is doing is they've posted a webinar on how to prepare. They've posted some guidelines, and those are helpful resources. They're not as in-depth, of course, as I'd like to see them, but what they're emphasizing is that, in particular, everything will take a lot more time. So as you're making your preparations, as you're making your plans, whether it's at the operational level, the community level, the resident level, all of that will take more time. So if a resident is filling a prescription in advance, that will take more time. If you're getting deliveries for your community, try to do that in a way that maintains distancing. So that's, instead of going to the store to stock up on supplies, that's getting deliveries. And because of the delays, that to give yourself more time. And then just to take a real close look at your emergency planning and see what needs to be adapted. So if you have a small room where you're expecting staff to shelter, that might not be sufficient, that you might need to add a second room to your plan so that folks can appropriately distance. So that's just one example of the kinds of ideas that they have there. And then what we're working on is getting HUD to give us some guidance on how things will be handled differently, what their expectations are. And again, this is something where we can really benefit from your input about what you need so that we can appropriately represent that to HUD and to Congress.
So Juliana, if I can ask real quick on that, and maybe if you want to send me a separate email or something, but if there's specific information that y'all may be looking for from our members, then as far as to assist with that, then we can reach out to them directly for some of those questions, potentially. If there's something certain that you're looking for, to kind of get some more feedback directly about that.
Yeah, I think right off the bat, I'd say I'm looking for the kinds of flexibilities and supports that you would need from HUD. So whether that's flexibility around maybe reporting requirements or evacuation requirements or rehousing type requirement, if there are flexibilities that would be helpful, and then support in terms of maybe extra guidance or funding, et cetera. But we can brainstorm and get some more specific questions.
Okay, great. Thank you.
Yeah, and with that, I think I'll turn it right over to Linda. Should I keep the screen shared or?
Yeah, you can keep it shared and help me move them forward.
Sure.
Thank you.
Real quick, Juliana and Linda, what's better? Do you want to hold all the questions to the end, or some questions I think have kind of tapped onto some of the stuff that Juliana has mentioned? What would you like better about?
I think in the interest of time, let me just run through this. It's pretty brief, and then we'll get to questions, which I'm sure will be much more focused on Juliana's, but this is a pretty brief update here, and you can move on, Juliana. So we just want to paint the picture of what's happened on the Hill, generally around COVID relief for affordable senior housing. The March 27th CARES Act provided about $12.5 billion for HUD. That included $1 billion for project-based rental assistance and $50 million for HUD Section 202 housing for the elderly program. And of that 50, it included 10 million, up to 10 million for service coordinators. You can move forward, Juliana. Okay, and as Juliana mentioned, that just Monday, HUD announced plans for the first $800 million of that $1 billion in PBRA to get dispersed. And what is concerning to us is that the 202 money hasn't been released, the service coordinator money hasn't been released, and in general, the only dollars that have been released have been to offset decreases in tenant income, where we know that senior communities aren't having those same decreases in tenant incomes, but they are having really pretty significant, you saw the survey results at the beginning, COVID-related costs. And so we are doing advocacy with both HUD and on the Hill to draw attention to the lack of release more than 2 months after the CARES Act of those, the COVID dollars for the 202 and for the service coordinators. And then really exciting news looking forward, there will be more COVID relief bills. And for the next COVID relief bill, which we see as being enacted before the beginning of August, Juliana mentioned the evictions moratorium for non-payment of rent. That expires July 24th. There are a lot of other provisions, deadlines, assistance in the CARES Act that expire around the end of July. And so there is a lot of focus to try to figure out the next steps there. For this next package of relief, what you see on the screen is a $1.2 billion package that Leading Age is particularly pushing. It's been introduced in this bill in the House, and Senate introduction is expected sometime in the next week or so. So what does that $1.2 billion include? The majority of it is for COVID relief, so for PPE, for cleaning and disinfecting, for all those services you all are providing. We're also asking for $300 million for service coordinators, and this is to get service coordinators into the about half of HUD senior housing communities that don't have one. We're also asking for $50 million for Wi-Fi wireless installation in both common areas and apartments, and then a small amount of money to continue HUD's I Wish demonstration for another year. That's set to expire in this September. And you can move forward, Juliana. About 2 weeks ago, the House did pass its first volley in that next COVID relief package, and that's called the HEROES Act. And that HEROES Act did include more than $700 billion in the HUD-assisted senior housing relief for PDRA and $200 million for the 202 program. So we were happy to see that those much bigger amounts in the HEROES Act. The HEROES Act also included $300 million for service coordinators that you saw in the standalone bill. And there's a lot of other money for housing assistance in there, but I just want to highlight the fact that the bill also includes $100 billion for emergency rental assistance. That's to help protect, really the millions of renters across the country who are facing some sort of evictions cliff this summer or whenever those evictions moratoria run out. Is that the last slide? You can't go forward anymore. All right, so now, we are really focused on the Senate, and we're doing a lot of Senate visits, a lot of Senate meetings. You'll see more action alerts in the next couple of weeks. You'll see a sign-on letter, you'll see a call-in day. This is Leading Age's affordable housing package, but we have a much broader package, of course, across the entire aging services continuum. So we just wanted to educate you a little bit about what we're working on the Hill, so that when you see those action alerts, hopefully you're compelled to make a call or write an email and help us get these requests over the finish line. So I'm happy to turn it back to you, Scott, see if there are questions.
Yes, we do have a few of them here that have people have sent to me directly here. First one I know is coming to Linda. Someone fairly trying to get a grasp of it still. When the HUD monies are released, how are the communities notified? Are these like grants or what? Just trying to get clarification about how they know about it.
So the first tranche, this $800 million in PBRA money, is HUD has called it invisible, seamless. You will get those through your voucher payment system, and they will HUD is calculating those based on your decreased tenant income. Though the remaining dollars, so the remaining $200 million chunk for PBRA, the 50 million or 40 million for 202, whatever they do with service coordinators, we really don't know how HUD is planning on distributing those dollars, notifying owners and agents about that money. And so, as soon as we know, we'll let you know. So, that's a great point. It's going to be important that you know the money's there so you can use it. So we don't know yet.
Okay, very good. Let me see. With the, does it matter whether you're a 202 or Section 8 or anything like that, with the $1,200 stimulus check, is that counted as part of the resident's income in any form or fashion?
It doesn't matter. HUD, for all federal programs, and particularly just speaking for the HUD programs, the stimulus economic impact payments from the IRS are not to be counted toward rent or toward program eligibility. And HUD has made that clear in its FAQ.
Okay. With move-ins and so forth, what are you hearing from members, which we talked about the poll, but more specifically, kind of going another step further with self-quarantine, if somebody's coming from like a rehab or personal care home, is there requirement? What is the guidance that HUD's saying in regards to that, or what?
Juliana?
Yeah, I can jump in. Can you hear me okay? My computer is, yeah, okay. Yeah, so that's that's a tricky one. I'm glad you're asking the hard questions.
No, leave it to our members.
Right. So this is an area that we've been very careful about, and we know that HUD is being very careful about. So there are concerns around fair housing, around all of these kinds of decisions, because as you guys know, a medical diagnosis isn't something to be considered in your housing delivery decisions. And so when you're making a decision around how to move somebody in, we know folks are not able to use a test as a condition of moving in. We do know that people are instead pivoting more toward this kind of quarantine idea. But right now, this is something that can only be kind of strongly recommended from the property. This is something that folks are doing. And so unless there is a state or local, like unless your local health department comes in and puts a quarantine in place more specifically, it's a property policy that would be a recommendation. But that is something that we've seen a lot of providers are doing. And Linda, did you want to round that out with anything?
Now, I'll just say that if you can in any way develop a relationship with your local health department and figure out, under what circumstances, because HUD has said clearly, we don't want to get in that space. And we want to be careful about fair housing. But if your local health department tells you can do it, do it. So it's, I think our members have had the whole variety of experiences as far as their relationships go with their local health departments. And so we really encourage folks to try to establish those and keep close communication.
And I'm going to assume probably this next question may kind of go with connecting with the local health department as well, but they're also asking to see if you've discussed it with other members in independent living. So as far as like temperature checks, continue to struggle with whether or not to conduct temperature checks in independent living for residents and or staff. So have you polled independent living specific communities on this topic? And if so, like, what is some of the information you're hearing and kind of how are they managing that process? Or if you haven't, maybe it's something that you could poll them to find out.
Yeah, for affordable housing, we have not. I can tell you that we've heard from some members who have the capacity to do like a temperature screen for visitors or essential service providers when they're coming in. But the vast majority of our affordable housing providers don't have the equipment, the capacity, the privacy, whatever it is, and are not doing temperature screening. I mean, we've heard a lot about, questionnaires, right? Or just a lot of signage, but I don't know, Juliana, if you have anything else to add.
Yeah, I think that this has been, like Linda said, a question of capacity. Visitor and access policies are set by the individual property, so it's certainly something you can implement if you have the logistical ability to do that. I think the folks that have done it have, maybe limited access to only a couple entrances, being mindful of local fire code and whatnot, and then had staff do those temperature checks with a temporal measuring tool. But it's not necessarily something that we've heard widespread across the industry, because it is really hard to implement.
Okay. Got a couple of more here. So with email that I sent to you as well, kind of on the capital expense, if you have it, whether it's a project or let's say it's something like an air conditioner that you have go out last minute, And we'll use an air conditioner as an example, being in Georgia and the heat cranking up here and stuff. We know that things are kind of, there's a backlog, if you will, figuratively speaking, with all the COVID stuff going on. So is there a way to kind of expedite things in any form or fashion if you have something of an emergency, such as like an air conditioner or something?
Mhm. Yeah, that's a good question. So I'll give some context. And during this crisis, and continuing, HUD has allowed for these kinds of reserve draws, reserve releases to be prioritized if they're for COVID-19, even if they're for non-traditional reasons. And so we know some regions have just asked that you put, COVID-19 in the subject line, and they're addressing those release requests with priority. So of course that gets exactly to your question, Scott, and that means, how is HUD handling these kinds of more traditional uses of funds for projects and for capital expenses. So we know that HUD more or less has been able to maintain regular operations throughout this. They've of course had to implement remote work, just like a lot of us have, and that there have been some associated disruptions. I know I've actually spoke with a member in Georgia who had some issues just getting an email back and forth where that wasn't working as well as it had before the crisis because of technology adaptations. So there's that element where where some folks are having some disruptions with their HUD counterparts that way. But really HUD, even though they're prioritizing those the COVID response, certainly capital needs that are being incurred or experienced should be addressed by HUD as well. And we have not heard that they're not doing that. So if there are delays, you should, please let us know. Of course, there have been delays, maybe more on the provider side, who are choosing not to allow, projects to move forward during this time in an effort to limit traffic in and out of the building. And so that turns more into a question of surplus cash management, and we're pushing HUD on that front.
Okay, very good. I know we're coming to the end here. I got one more. I want to combine these two into one question here. And this is maybe a blend for the two of you, actually. So has anyone asked if HUD are they going to provide any guidance or statement requiring masks to be worn in common areas? And then are the service coordinator dollars for new service coordinators or for existing grants?
I'll just take a first stab at this and then let Juliana give you probably the real answer. But that, on the masks, my guess is that HUD is going to defer to CDC. And on the service coordinator grants, we unfortunately are seeing some communities, we saw one this week, still not have their calendar year grant money in their accounts, which is really distressing. Juliana?
Yeah, so on the masks, that is something that that's in the CDC's purview, and they had recommended that for common areas, and so that is something you can recommend at your at your properties. But of course, that's difficult, a difficult thing to enforce, to work on. And then on the service coordinator side, that the new dollars was, maybe the question was about the new funding, and that
Yes.
and we're seeing that would go toward existing service coordinator accounts. Is that right, Linda?
Well, yeah. So the $10 million from the CARES Act, we're very confident that money would go to existing service coordinators to help them address their current needs. The $300 million we're trying to get in the next relief package from Congress, the majority of that would actually go to, some of it, we're thinking around 30 million would go to existing, and around $270 million would go to get new service coordinators in communities that don't have them.
Okay, very good. All right, I think that is, I just posted out there if anybody else had any additional questions. But I think that is everyone. One question, just to make sure I heard you clearly, back to the signature part. So the electronic is an option, but you said that some states may still require a wet signature. Is that correct?
Yeah, so the electronic signature guidance from HUD allows you to adopt these policies but you have to be in compliance with other federal and state requirements around that. So where that comes into play at the state level is that some states, many states have a requirement that a lease in particular or a lease addendum be in paper format. So that's just an example of something that you'd have to check with council and make sure that you're in compliance with your state requirements with that. But the vast majority of forms can be electronic under this guidance.
Okay.
And these
I did
exceptions are listed.
I did record this session for everybody once I can figure out how to share it. I don't know if the recording will show the slides. It may only show be the voice part. But we can see about what information we can get to share back and send it back out in an email to everyone. So, okay, great. I think that is everything there. So Juliana and Linda, thank you so much for one, not only being a part of this call today, but two, for everything that you're doing for our members and stuff like that with the affordable housing. I know they greatly appreciate it. And I know they're very appreciative of this call today. So thank you very much.
Thank you.
Yeah, thanks, Scott. And we'll share our slides with you.
All right, great. Thank you. Y'all have a great day.
You too.
Thanks, everybody.